The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of non-invasive or minimally invasive facial rejuvenation. With us, we have an expert on the topic. We're talking about new breakthroughs in skincare, how to look years younger without surgery. With us, we have board-certified dermatologist, Dr. Ed Becker. Dr. Becker, welcome to the program.
Nice to see you, Randy. Thank you very much for having me.
Now, before we get into today's topic, tell me a little bit about your practice for people that don't know. It's in Walnut Creek, California. You've been there about 20 years, and according to your website, it looks like you do a lot of things there.
Yeah, we have a very big, busy dermatology practice. About 70% of what we do is regular general dermatology, and in that we treat all the common and even uncommon medical and surgical dermatology conditions. And the other 30% of the practice is cosmetic dermatology. And in the last 10 to 15 years, that part of the practice has really been growing as new technologies.
You say you're busier than ever. You told me in the green room.
Yeah, I'm busier than I've ever been. Every year gets busier than it used to be.
And you also told me this on that you can make somebody look 4 or 5 years younger by just making them have, great skin.
Well, dermatologists are the experts in the skin. That's what we deal with all day long, every day. I've been doing it for over 25 years. And we can change people's skin. We can push the clock back. We can reverse some of the signs of aging and sun damage. We can slow the aging process through a variety of different ways. And when I think about the aging face, what defines the beauty, in your opinion? Well, when you think about beauty, first we have to look at a beautiful, youthful skin. And what does beautiful, youthful skin have? It's smooth, it's clear, it's bright, it's reflective, it's tight. When you compare that, to be able to understand what the aging skin looks like, you have to know what the youthful skin looks like. The aging skin, there are really 5 major factors that change in the skin that people say that they're aging.
Okay.
People sometimes don't even know what they are. They just know, I don't look like I used to look. A woman's turning 50, and it's emotionally, psychologically, sometimes a traumatic point, those milestone birthdays, whether it's 30, 40, 50, 60, 70, whatever it is, those milestones.
But at 50, on a consult, what are you looking at? What are those 5 things you look at?
The first thing is skin color. And the youthful skin is clear, bright, reflective, and as we get older, as we age, the sun has damaged our skin, so we get variation in the color. We have brown spots.
Interesting, okay.
We get some redness in the skin from dilated capillaries because the sun has damaged the collagen and gives you this kind of rosy background to your skin with this blotchy mottled brown pigmentation. And the other thing that happens is the skin gets dulled. So when you're young, your skin is very light, bright, and reflective. And as a skin,
when you say reflective, what do you mean? Because you've said it a couple of times.
When you look at young people, look at their cheeks, how the light reflects off. It's so much clearer and brighter. Where when you're older, the sun damage, the light doesn't reflect off. What we see is what's light that's reflected off of something. That's what we see.
Okay.
What you don't see.
Interesting.
The light that's absorbed, you don't see. And as you age and the skin is sun damaged, more of the light is absorbed, and so you don't get that reflection back. So the skin just doesn't look as bright.
And and women are wearing a lot of makeup to cover these. This unevenness of color.
That's right. And what we can do, there's a variety of different techniques. People can start out with simple cosmeceuticals, hydroquinone, bleach, retin-A, tretinoin can help. You always have to use sunscreen because that's going to prevent further damage. No matter what kind of procedure or treatment someone has, sunscreen has to be an integral part of any skincare treatment. The second component of aging is loss of volume. So young people have smooth skin with all the bulges in the right places.
Okay.
And as we age, fat gets redistributed in our skin. So when you're younger, you have more volume on the upper face, on your cheeks, less down in the lower part of the face. And as you age, the volume often shifts downward. And with loss of volume, we can use fillers to plump up the loss of volume. And the real key with fillers is not to overdo it. Everyone's seen.
Yeah, we have.
Women with these enormous lips.
In fact, I oftentimes tell people, I'm anti-fillers because it seems so obvious. And it doesn't look good or natural.
Well, The reason that happens is they didn't have it done correctly. The key with a filler is not to fill 100%.
Do you see it, by the way?
Almost every time we go out to a restaurant or we go out somewhere to a party, I will always see someone who, the most common area that's overfilled is the lips. Women sometimes are given these lips with a filler that are just essentially deformed. They're just so unnatural. The goal of a filler...
Do women think that makes them look younger, by the way? Do women come to you and say, I want that?
Sometimes they come and ask me to do that. I won't do it because
Really?
I don't believe it looks good. It doesn't look natural. The goal of every cosmetic procedure, whatever it is to have someone look younger, look better, have them look rested, refreshed, but natural.
So the doctor that you go to, I had a plastic surgeon tell me one time, I said, what's your take on these big lips out there in Newport Beach? And he goes, Randy, there are some doctors that actually think that looks good.
Well, if a patient wants that, those are the doctors they need to go to.
Right, but some doctors think that looks good. So you don't think it looks good?
I don't think that looks good at all. It's so unnatural. Okay. I just refuse to do it. If someone wants that, they have to go somewhere else. Do
you think as a dermatologist, do you have a bias? Do you believe that people should look, because it doesn't cost more to go to a specialist? Are you of that opinion that if you're going to do something to your skin, to your face, or get fillers, go to a dermatologist, like a cosmetic dermatologist?
Well, I'm biased because I am a dermatologist. I've spent years in training and in practice treating the skin. Dermatologists understand how the skin responds to all different kinds of stimuli, how wound healing occurs, and how skin quality and texture can develop and change. So dermatologists, this is our field. You wouldn't go to a dermatologist to ask them about a stomach ulcer or chest pain. Okay. Just like you wouldn't go to your cardiologist and ask them about how to take care of your wrinkles.
Okay, all right. Now we were talking about the 5 things you look at with the aging face.
Yeah, so the first was color, second was volume, the third is fine lines and skin texture. And the youthful skin, let's go back to what youthful skin has. That's smooth skin, that's very elastic, and as we age, the skin gets thinner from sun damage, the skin gets a little looser, the texture changes, and the loss of elasticity causes that textural change. This is the area in which the new fractionated lasers really shine. We can discuss that later.
Yeah, because you have the new technology for the most part. You're big on technology. Yeah. Okay, so the 5 components you're looking at:
color, loss of volume, texture, and fine lines. The next category is wrinkles, and they could be moderate wrinkles to deep wrinkles. And doctors, you go through training, and there are doctors called lumpers and doctors called splitters. And with wrinkles,
what is this?
Those are the doctors who kind of group everything together, the lumpers, and the splitters who split everything apart.
What are you?
With wrinkles, I'm more of a splitter, because you can have moderate or deep, fine, moderate, or deep wrinkles. But the bigger way I divide wrinkles are wrinkles that occur from motion and wrinkles that are present at rest. The wrinkles that occur from motion are the ones on the upper part of the face, the frown, the forehead lines, the crow's feet. Those lines are due to muscle movement, and the muscle contracts, pulls the skin, folds the skin, and causes those lines. Lines of motion have to be treated with Botox. Because that stops the muscle movement, that prevents the movement of the overlying skin. You also can use fillers along with that. Lines that occur at rest, such as the smile lines, the lines down here on the chin, in the corner of the mouth, that's where you use fillers predominantly. And again, the key is underfill rather than overfill.
Now women that come in today, and by the way, what's the average age of the women and men that you see that are coming in for these procedures?
Generally, they're coming in often starting in the 30s, but most of them between 35 to 60s.
Okay.
And the biggest bunch probably 35 to 55.
Okay, so laxity. What are you doing for laxity? Loose skin.
That's the 5th of the features that you see in aging skin. And you look at the youthful face, once again, you have to go back to youth. It's tight and smooth with tremendous elasticity. You pull on the skin, it snaps right back. As we get older, that snap response, it's not what it used to be.
Could you give people some of that back?
We can give some of that back by using radiofrequency treatments with thermage, where we can help tighten the skin. All these procedures that are affecting under the surface are heating the skin and turning on the cells in the skin that produce collagen. So we're turning on this factory of collagen-producing cells called fibroblasts to produce new collagen that over time, over a 3 to 6 month period of time, matures and contracts and tightens and smooths the skin. We can only do so much with non-invasive treatments. There are patients who definitely need surgery.
Okay.
The hope is to be able to forestall surgery as much as possible, but when someone needs surgery, I have no problem telling somebody there's not something that I can do that's going to help them, that they need to go see a plastic surgeon and have a facelift.
Okay, good. For the age, let's start with a 40-year-old. Okay, so for a 40-year-old, comes in, taking pretty good care of their skin over the years. What's the hot procedure? I mean, what are they requesting the most? What's your favorite procedure to kind of maybe turn back the time a little bit?
Well, the critical thing is a consult with the patient, to listen to the patient. What bothers them? What are they concerned about? It's not so much what I see, it's more what they see, because what they see is affecting them, it's upsetting them, it's making them have less self-confidence, maybe less self-esteem, maybe not being able to do things that they might otherwise do. So the critical thing for me, and one of the reasons why I have patients keep coming back, is I'll listen to them. I want to learn what it is that's their issue. And once I've heard what their issue is, then we can devise a plan that fits what their issue is. And it can be any one of these 5 or any combination of these 5. So we can take each one at a time, because a 40-year-old may have any one of these, probably less likely an issue with laxity. But if they have an issue with skin coloration, and they say, I'm just starting to see this little brown spots all over my face. It's just not as clear as it used to be. Well, for those patients, we can use IPL or intense pulse light treatments, or this new thulium Fraxel laser. The Fraxel dual laser it's a machine.
You love this new machine. You told me. You said it's your favorite machine.
Yeah, it's a fabulous machine.
It's a dual fractionated laser.
It's a dual fractionated laser.
What does that mean, dual?
It has two different lasers built into the same laser. So it's 2 different wavelengths. One is the old Restore laser from Fraxel that does a wonderful job on fine lines, skin texture, and helps with pigmentation. But it's a series of treatments done once a month, 4 or 5 times, and there's a slow, gradual improvement. The second head of this laser, this new thulium laser, is a different wavelength that doesn't penetrate as deeply into the skin. It's absorbed more superficially, so it does a much better job on pigmentation. And one of the, in the past, even I think you said at the start of the show, we're going to talk about facial rejuvenation. And you probably have done shows over years and years, people talk about facial rejuvenation. Well, It's not facial rejuvenation anymore, it's skin rejuvenation, because now with technology, are not limited to just treating the face. Because before, when my first laser I bought in the late 1990s, all we could treat was the face. And you could improve people's face, but it never would match their neck, their chest, their hands, their arms. So they might look younger here, but people were afraid to show other areas. Women wouldn't wear a lot of jewelry on their hands because it would attract attention to their hands, which didn't match their face. Now with the new technologies, we can treat anywhere on the body. So we can match the
What about chest? I mean, women's chest, I hear that's a tricky area to...
With this new thulium laser, we can treat the chest, because the laser allows you to adjust how you do the treatment. You can adjust the energy level, which has something to determine the depth of penetration. You can adjust the percentage of the skin you treated. A fractional laser means you're treating a fraction or percentage of the skin. And you just set the dials on the laser to treat a varying percentage of the skin depending upon where you're treating. So the face, you can treat a much higher percentage, so you get a faster and better result, because you're treating 50, 60, 70% of the skin, whereas you're not treating 30, 40, 50% of the skin. So it helps you to heal
So this
faster.
fractionated laser, okay, so it's heats the skin. Is that correct? It goes through the skin.
So the laser beam goes into the skin, and every laser has a certain wavelength that's designed to be absorbed by something specific in the skin. And any laser works the same way. When the laser beam is absorbed, heat is generated, and whatever absorbs the heat is damaged. You inflame the dermis. The cells in the dermis called fibroblasts produce the collagen and help to smooth the skin over time.
So what else is this Fraxel good for?
Well, the other head of the Fraxel laser is called the Restore laser. This laser does the fine little laser beams are absorbed more in the superficial dermis, generating new collagen formation to help smooth and tighten fine wrinkles and improve skin texture. So again, that crepey skin that age skin has can become more like the smoother, tighter.
Is it good for under the eyes?
It's very good.
Because that's where everybody gets, seems like the crepiness is under the eyes.
It's very good for around the eyes. It's a series of treatments. You won't see a lot with one single treatment, because there's treatment upon treatment gives you.
Like every 3 months you do it?
Probably once every month to 6 weeks, you'll do a treatment around the eyes, and you'll get gradual improvement with more collagen and smoother and tighter skin.
You'll wipe out those that crepey skin under the eyes over time.
We can greatly improve it. We're not going to wipe it out, but we can greatly improve it.
Okay.
And you can sometimes combine that with Botox for the lines, the crow's feet, which are due to the muscle movement, and make significant changes. Now, for the patient who has very deep lines and very extensive lines, this laser just doesn't penetrate deep enough.
So what do you do?
So we have an ultra pulse CO2 laser, which goes much deeper into the dermis, produces a much deeper injury, much more collagen formation, and smooths and tightens.
So
skin.
this CO2 laser,
Yeah.
so under the eyes or the whole face?
You treat the entire face. The areas that are best respond, the deeper lines on the cheeks, because if you have multiple lines on the cheeks, you can't put a filler in all those lines. The Fraxel laser doesn't necessarily go deep enough.
So the Fraxel's for the younger patient?
The Fraxel is often for the younger patient, for texture, fine lines, and color issues, brown color of the skin. The Ultra Pulse, the CO2 resurfacing laser, is for deeper lines, more significant sun damage, but the downside is that there is downtime. This is
for the CO2 treatment.
The CO2, because that's what's called an ablative laser. What ablative means is that you're destroying the surface skin. So you get a true wound. You get an oozing, crusting wound with an ablative laser. You get a much better result, but people have to take a week off, and it'll be a month of time till all the redness
So the 50,
fades.
60-year-old with a lot of sun damage, they start there, but do they have maintenance with these fractionated lasers that are out there?
Once someone has been resurfaced with the CO2 laser, they may, in the future,
For maintenance?
for maintenance, have a more superficial laser for some skin pigmentation and fine textural changes that will, again, develop over time. But the deeper lines need the deeper laser.
How much better, by the way, are the results now that you're able to get with skin and youthful-looking skin just 5 years ago? I mean, how much better are you now than just 5 years ago?
Significantly better, especially off the face. I think the biggest changes have occurred with treating non-facial skin in the last 5 years. The lasers for the face have been very, very good for quite a while. The big advancement is being able to treat other areas we couldn't treat before. As I mentioned before, my first laser was in the late 1990s. If I would use that laser on anyone's neck or chest, I would absolutely 100% of the time produce a scar. Now I have a laser.
So the lasers were much harsher before, where you couldn't treat the neck and chest because they created like a marble or marbleized look, scar tissue look?
It could produce a marbleized look on the face, but it would scar other areas. Because the old lasers, 100% of the skin was treated with the CO2 laser. Because of the uneven and bad results from that, it went out of favor, and several years later, the fractionated, someone came up with the idea, let's treat a fraction or percentage of the skin so you get a very good result. Not as good a result, but you don't have the risks and that whitish total loss of pigment and the potential for scarring with these fractional lasers.
So a lot of the women that are out there, just, they got a facelift 5 years ago, 8 years ago, 10 years ago, and they have these necks that don't match or the upper chest that don't match. Is this an ideal candidate to come in and start hitting that with a fractionated laser?
They're very, very good candidates for that, because the face has already been treated. But if they've only had a facelift and the surface skin hasn't been resurfaced, they probably have textural and color problems and fine line issues on their face, because the facelift is really dealing with laxity and some deep lines, but it doesn't deal with two of the other factors that you see is color change and fine lines and texture.
Okay.
And so
even a beet red chest on a 45-year-old, 40-year-old, I know somebody like this, they're always complaining about their chest. They go, I was told by somebody that you can't do that. There's nothing you can do. I said, I don't think so. I mean, that's not what I'm being told by guys like you.
The beet red chest is one of the most difficult things to treat. That can be treated with IPL, with vascular lasers. That's more difficult. If it's brown irregular pigmentation mottled, very easy to treat with new lasers anywhere on the body.
I mean, it's not beet red, but I mean, it has that red tone. You just do multiple treatments?
Yeah, you do multiple treatments with IPL. But the red is harder to eliminate and reduce than the brown. Okay. It's a little more of a challenge and requires more treatments.
And hands, I mean, is that a common area? Hands that you're treating?
Hands are very common area.
You have young-looking hands. Did you dip into some of the technology?
I lasered my hands a few months ago.
Is that right? Yeah, because I was thinking, this guy's got young-looking hands.
Well, see, we can only treat maximum 35% coverage of the hands with one treatment. So to really treat the hands to get the best result, you need 2 or 3 treatments. So I've only had 1. I just have to find some time that I don't mind having some peeling on the backs of my hands and just do it again.
Okay, in an economy like this, how important is looking great or having great skin? I mean, you're a dermatologist. I mean, what's your take? How important is skin?
I'm biased. Skin is the most important organ of the body.
Okay.
And having great skin, no matter what your age, if you have great skin, you're going to look really good. And if you look good, you're going to feel better about yourself. You're going to potentially get that job that you wanted to get, or that promotion you're looking to get, or maybe have the relationship you're looking to have. Great skin.
It's true. I mean, when I see a 50-year-old female, 45-year-old female, mid-40s, and they have great skin, I mean, that's attractive. And it also adds sophistication to it. I mean, we're an employer. I mean, I interview people, and I was telling a guy the other day, if there were 2 twins that I was interviewing, both same backgrounds, the person that looked the most vibrant, you couldn't help but want to hire that person. Yeah. The person that looks like they have the most energy.
Yeah. And that's unfair.
Yeah, it is.
But that is reality. That people who have, good skin, people think they're more energetic, they're more alive. It's an unfair advantage that these people have.
Do you see changes, by the way? I mean, do you see self-esteem changes that they come back for follow-up and they're acting differently, dressing differently?
Oh, yeah, you see it. No matter what somebody starts, people usually start in our cosmetic practice with Botox and fillers. They used to start with microdermabrasion and superficial chemical peels. Now they're starting more with Botox and fillers, and they look better, and they say, what else can you do for me? So we start in with these different laser procedures or intense pulse light, and they keep coming back. They're looking better. They want more. They want to keep improving. But along with the procedures, we have to get them on a good maintenance program so they don't lose the benefits they've had.
Okay, tightening with thermage, and we're running out of time, and I know you use this in combination with other procedures. What's your take on thermage?
Thermage is for someone who doesn't need a facelift, who has some laxity, a little looseness of the jawline, of the cheeks, particularly around the eyes. And
really? Okay.
It works wonderfully on the upper eyelids. Much better on the upper eyelids
Never
than
heard
the lower
that.
eyelids.
Okay.
Where you don't want any surgery, don't want any downtime. They have the procedure. They can go out for dinner the same night. It's as though nothing happened. But there's a delay, a 3 to 6 month delay before the collagen and the tightening can occur. The one problem is it's not as predictable as some of the other lasers. The results, sometimes you get the home run, and sometimes you don't get much of a result at all. So I think.
But when the patient goes back to you, I mean, you have settings on these machines. You could kind of push it and push it. Is that right?
Well, we can push it to tolerance. The key is what is the feedback the patient is providing, how much they can tolerate.
Like if they could tolerate, a 7-day downtime.
Oh no,
that's one thing, or
no,
something.
No, it's not. With thermage, there is no downtime.
Okay.
It's how much discomfort they can take during the procedure.
So you like thermage in combination with these other procedures?
For the right candidate, it can be a very good procedure. But they need to be seen and evaluated. We need to really discuss what the potential results are.
You told me people will go to you sometimes because they know your personality, they know you, and I'm paraphrasing, because they say that you'll tell them the truth. Like, does this work? Is this a gimmick?
Yeah, I've had patients.
Would you have people say that?
I've had patients come in to see me for 25 years, and they come because I know I'll tell them the truth. I'll tell them whether something's going to work for them or not. I provide new procedures all the time, and the last thing I want to do is overpromise and underdeliver. I'd much rather underpromise and overdeliver.
Okay.
So, and I have no problem, and we're very busy. I have no problem sending someone to someone else. If there's a better procedure that someone can have, that someone else does that I don't do, I send them to the other person.
Now, darker skin, olive skin, you have the new technology to take care of that?
We can treat.
Because our makeup artist, she said, well, I have olive skin, I have freckling that I'd like to get rid of, and I've been told I can't do it. Is that because she went to somebody that had old technology?
I think she went to someone with old technology.
But they're out there everywhere, right?
Yeah, I saw her, and she's a perfect candidate for this new thulium fraxel laser.
And she was told that, well, you have too dark of skin.
No.
She went to the wrong place.
Well, they went to a place that didn't have this new technology.
With the Wellness Hour, we like people to know, because I think when people ask me because they know I interview people like you, okay, doctors like you, and I say, I think the biggest scare out there is not everybody has the new technology. If the machine's just 3 years old, 4 years old,
it's out of date.
Right.
But not everybody can
And you have the new stuff, though, because these are expensive machines.
But you can't have everything. So you have to really do your research and to make a determination what you're going to bring and what you're going to add, because no one can have everything. Maybe the big university settings can have everything, but a private practitioner can only have
Do you have what you think is the best stuff out there, based on your research?
Right now, I think we have some of the best stuff you can possibly have. Plus, we have this new cool sculpting, which is for fat reduction, which is just...
You love that.
It is an amazing
You're lopsided, I understand.
Well, I treated one side, not the other, so I'm a little bit lopsided, because I wanted to prove that it worked.
This is like different than liposuction, and I guess you cool the fat to almost freezing temperatures, kill the fat cells, and the body eliminates it. Is that right?
That's correct.
Okay.
And over a 3 to 4 month period of time, the fat cells die, disintegrate, get taken away, the skin fat layer collapses, and it's smoother skin with a decreased amount of fat.
Okay, good. I'm going to have to invite you back to talk about other topics, and that cool sculpting is one of them. So I want to thank you for coming on the show. Great information.
Nice
so
to see you, Randy.
You do all the consults? They meet with you one-on-one?
Yes.
Everybody? Okay,
Yes.
good. Thanks again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.